Where is it hurting then?
The lower back. Holding the welder in one hand and the mask in the other. Or holding the pipe and welding.
What did the MRI say then?
The doctor?
Mm-hmm.
He pretty much told me to find a different job.
Yeah.
He really told me a whole lot, honestly.
Mainly from hard working.
Yeah, so you have a pelvic tilt like this.
Yep.
Okay, and you are leaning. You're really blowing out that left-hand side. You got to compress that. You're leaning like this. So it's going to be stretched out and fill up with fluid. When you do welding, are you leaning to your right more?
Yep. I could be leaning like this, reaching.
But do you ever go to the left?
If I have to.
You know what I'm saying? Like, okay, you have low back pain. You have swelling on the left. Probably from reaching to the right. And you're saying, yes, I reach to the right. Okay, can we reach to the left instead? You know what I'm saying? Like, you're all swollen. This part of you is twice the size of the right. Clear as day right here. It's all swollen in here.
I can feel it when I try to work or move sometimes. You can feel it like grab me or like pinch me.
Now that might be the lower part down here. Yeah. No significant around. Posterior diffuse disc bulge, indented, mild narrowing. You should look at some people's backs sometimes. Okay. This isn't, how old are you?
28.
Okay, maybe this one here. Disc herniation L5S1. Okay. So really the two that you're most worried about are these lower guys right here. L4, L5, and L5S1. With right foraminal annular increased signal intensity, tear, edema, inflammation. So they're saying that it's bulging to the right.
I have pictures of my x-rays if you want to see that.
This is more important. When you blow through your 20s and your teens, you think you're invincible, and then you get to around 30 and you're like, oh crap, can't do that anymore. I know. I beat myself up. Most injuries occur before 18. Have you ever had a massage or anything?
No.
No. Stop me, okay, if anything feels bad, all right? Come on and scoot up towards me. Right there you go. Because I'm going to go to work, and if you're not used to it, and if...
Give it to me.
Okay. You don't have to tell me twice. Here we go. Out there. Oh. This is like cleaning out, you know, when like the gears, going in there and like scrubbing out each little tooth.
Yep.
That's what I'm doing here, okay? You only got one. Take care of it.
Yep.
That's what you hear. He's here, he's doing it. It's just...
A little too late?
No, it's never too late. No, I see kids coming in here, 16-year-olds like that. Okay? It's pretty bad. Life is not easy. No, you're okay. But you don't want it to happen to the next ones above. So you gotta think, what did I do that caused it? It might not even have been your work. It might have been like what you do at home. Do you sleep on that side? Okay, we sleep for like, what, 8-10 hours if we're lucky? That's a long time in one position.
He sleeps on his right side.
Right side?
Right side, yep.
You look for things where he's leaning to the right. And if it is the work, then it is the work, okay? Hi. Ugh. Create your own hours.
Yep.
There you go. Here you go. Perfect. Let's see if I get another level. Is that okay?
Mm-hmm.
Okay.
Here.
And another side. Chin back. Chin back. Go, 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 go. Whoa! There he is. I gotta get you. Wait. Okay. Here. Thank God. There we go. Got it. Perfect. I'm gonna place some weight on the inside of your foot here. Same thing. Fell over here. Okay, so I'm not gonna worry about that. Perfect. Good. Oh, this side isn't as flexible. Okay. Good. Oh, that was a whole leg. Anything hurt your low back when I did that?
No.
How about that side?
No.
Here we go. I'm gonna hit this one. Perfect. Bend. Good. Good. Reach overhead and grab the table for me. Give me just some little bit of counter force, but relax the leg. Perfect. Good. All right. Now let's see that back. One shirt off on your stomach. Yeah. You okay?
Yeah.
You dizzy? Don't fall on me. Don't cut that back out. Wardrobe. Okay. Do you see? Can you, Linnea, see it? She's not a chiropractor. You know? Yeah, that's rotated right there too. There's the TP. I can't feel the TP of this one. It's way down in there. That one is right up on the surface.
As you're poking at it, this side is sinking more than this one.
Right, do you see that? See that that's all in a spasm there. That's the side of his lumbar right there. And then this side, it's all flesh. There's no bone over here because it's actually rotated this way. It's sticking higher on this side. So I don't want to push into that and make that worse, right? But I can go ahead and try to, see that? Try to pop this out. Does this feel good or bad?
Feels good.
Should feel good. Take some of that tension out of there.
It's making my legs shake.
Which one? Which one?
Mm.
Left one. It's 'cause it's just so swollen. There's some edema in here, okay? Okay, more oil. Lots of oil. There we go. Breathe. It's okay, it's okay. Here we go. That's what I want. Come on. So right there, it turns right there. Gotta concentrate right here on him. Are you okay?
Yep.
You alright? You ticklish?
Yeah, right there. It feels ticklish.
It's a huge, see that? It makes it go straight. Spine comes back to normal. To neutral there. Right there, right there, right there. Woo! Come on. You okay though?
Yeah.
Okay, you let me know if you want me to stop. It happened. Oh, there we go. That's it. Perfect. You need a lot of this. Can't stop with today. You gotta keep going. Oh my goodness. Oh, but it looks so nice. Can you see it?
Oh, I can't. His butt's in my way.
Okay, he's all swollen right here.
Oh, yeah.
Can you see? Can you see that it like this side? There's goes
Yeah,
in,
it's more sunken in.
and look at this. Okay, I'm pushing right there, and it makes him cough a little bit because I'm hitting like the lung. Okay, right there. I don't really want to get down into here or we'd start messing with this. So it's just right there. There it goes.
Oh, yes, yeah.
It'll pull it this way. You want this to contract and pull the spine that way. But if I go too low, you undo, then it's going to go that way. Right there, it'll start cramping. Then you'll see his body go that way. Perfect. Boy. She's just pressing into people.
No.
Yeah. Yeah, that's what I want. So what am I doing? Okay, the discs are herniated. Now what? Get as much of that fluid out of there as we can. All right, as much as we can. You're going to be sore for a few days, okay?
All right.
I'm going to open this up a little bit. Does that feel okay?
Yep.
All right. Just taking the sacrum, gonna pull open. Give a little more space for that disc. Even though it's been herniated, I still don't want it to just sit there being crushed. You know, try to get some space in there. We can always go up into the upper back. That's always lovely up there. This is always sore on everybody. Forever and always. Especially if your arms are above your head all day. It's going to be sore no matter what you do. Oh, hi. Here we go. Breathe. Let's just do it. Most painful one right here. Here we go. Breathe. Right here, right here. Oh, there it goes. Done. All right, take a deep breath in. Perfect. And again. Let it all out. Let it all out. Here we go. Oh. There it goes. Perfect. You're doing good. You're doing good. This is not easy.
So your arms get tired.
Perfect.
You're not used to it.
Well, just like him with welding, you get used to the motion, but what you can't get used to is that twist. So that's why you see me doing all these weird, because I'm trying to keep my back. I'm giving out. Okay, I'm going to reach on the front of your bone here, okay? Right in front of your pelvis. Right there. I know. Breathe. Come on. I'm just saying, you ain't the first person that's come in here like this. We can help you, all right?
Cool.
Is that some roller bruising?
No, I didn't use a roller on him.
Oh, really?
No, he's a little ticklish. So just my elbow. The roller's artificial. You know, it's something about silicone. And metal, it works better than rubber. It's like coming out one bloop at a time. Woo!
What is that?
Scar tissue. Fascial adhesion. Or BS, according to some people. They say this doesn't work. As he shifts, there it goes. Oh, your skin is real flexible. That might be a clue. Do you notice that you're flexible compared to other people? Like, think way back, like when you were a kid.
Not really.
Not
Never
really?
noticed it.
I have to test you out a little bit. You could just be real thin, so I'm able to pull your skin, but usually when I can pull somebody's skin that far, that means they have some kind of hypermobility.
Mm.
Like their collagen fibers are just real flexible, which puts you a little bit more unstable, makes you more unstable than some people. So that's just another clue. It's just another piece of information for myself to tell you to stop working like that. Like that. See, in North Dakota, there was no stop working. Okay, there was no, you could not tell somebody to not work in North Dakota. They would literally die trying.
Yep.
Okay, so when I hear doctors like willy-nilly throw that around, I'm like, excuse me. You know, this person has to still feed themselves. Is there any way we can rehab this person, maybe? So they can continue to work? I never told one person, don't go to work. It was like, okay, what can I do to patch you back up, to send you back out again? If it meant wearing a low back brace, it meant wearing a low back brace. You understand? You know, those guys make over $100,000 a year. They ain't gonna give that up. No matter what doctor tells you anything, okay? So it's way different than here, than the dynamics of Florida. You cannot tell a oil field worker to stop working because they ain't gonna do it. So you have to find another way. So that's my training versus somebody else, okay? And I used to just sit there and work on these oil field guys, and they just lay there like you are. Do whatever, do your worst. And it took me little by little. I used to have my Netter's anatomy book, and I would look at it and say, okay, what muscle on my, because you don't remember. You can't possibly keep all that in your head. After 8 years, you'd think you have most of it in your head, but there's still little details that you can't remember. And I would sit there and, okay, where am I on? And I'd watch, okay, which muscle? Which muscle can I pull? Which muscle can I influence, okay? Oh, this is bad. Okay, arms up over your head, touch elbow to elbow. Elbow to elbow. Nah. You found some restriction. Okay, let me get it just real quick. Okay, other side. Oh, you're almost done. You're almost done. You're doing good. Oh, it looks so good now. Arms down. Your girlfriend's like, it looks bad! So go ahead, you can take a picture of him. Come on up.
You ready?
He got mauled.
Look at my back.
He hasn't seen it yet.
Thanks.
Okay.
To this lovely lady.
He ain't hurt. So go wait in 7 days. All right.
Whew.
All right, shirt on for me. And then you're gonna look back off the table. Bottom leg is straight, top leg is bent. Perfect. Back. Okay. And then head back for me. There you go. Good. Other side. Top leg is bent. Good. Then head goes back off the table. No? Okay. Oh, your ribs popped there. Good. Oh. I can't get that side. On your back for me. Get some ribs way out of place. Did that hurt your ribs on the front? Are you okay?
Yep.
Okay.
I had to wear back braces in 7th grade. They said I should.
All right, come on up and see how it feels. Yep, I got some more pops to do, but how does it feel otherwise?
Feels a lot. Feels tender.
Tender, but does it feel any looser?
Yep.
Okay. Have a seat here and face that way. Sit up as straight as you can. Looks better. We're getting there. All right, elbow back towards mine. Yep, you got it. Relax. And elbow back. Good, that's all it's gonna go. That was the upper extremities. That was pretty much head to toe adjustment there, okay? Now, what we're gonna do, where's the foam roller? Right, no, just to there. Head back. Bend your knees. Right there. Arms up and over. Feel like a stretch.
Yep.
Breathe. You think you can wait 5 minutes?
Yeah.
Hold it there. Okay. Try. Okay. When you're home relaxing, try not to be rounded in the couch. you're gonna blow this out.
Right.
Am I making sense?
Yep.
Okay. This is bad. This is good. Even though it's kind of weird because this is how we think he was. I don't think you were. I think it was more like this. Okay? And then maybe you were up here. But this lower back, there's no way that you were back. Because I've seen people that work back. It doesn't look like that.
Okay.
This is so swollen on that left-hand side. So try not to lean to the right. Do you understand how that would make it more swollen? Yes? Okay, because I really don't want it to get worse.
Yeah.
Okay, because getting worse is going to be forward and to the right. Don't sleep like this to the right either. Make sure you're sleeping towards the left or in a neutral spot. Okay?
Okay.
All right. That's enough for today. I hope I won't overwhelm you with information, but that's just what I see, okay?